Awesome. Good evening, everyone. My name is Michelle Avila, and I am the chair of the Health and Human Services Committee. Thank you so much for being here tonight. I will pull up the committee agenda in a few moments, but before then, I will read the committee guidelines. On February 19th, 2023, Mayor Adams issued Executive Order 339, extending the state of emergency through now April 2023. Accordingly, boards are able to continue to act under the state of emergency section of the video conferencing law, chapter 56, part WW. This allows the board to continue remotely. Minutes and video recording will be made available on our website. If you're calling into the meeting on a conference line, the controls while joining by land or cell are as follows. To hear all available commands, enter ** on your phone. *6 mutes or unmutes yourself, and *9 virtually raises your hand. The code of conduct for the meetings is as follows. Bronx Community Board 7 has the right to remove and or ask a member of the public to leave a meeting or block participation of anyone who engages in inappropriate conduct, including but not limited to obscene or offensive images or language, personal attacks, threats, or any other behavior that reasonably impedes the orderly administration of the meeting. Repeated offenses will be reviewed by the board's executive committee or the assigned committee for a ban of the participant, the amount of time to be objectively determined by the above committee in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and the authority shall be summoned. Everyone besides the speaker or presenter will stay muted throughout the meeting. After each presentation is over, I will inquire if committee members have questions. Committee members will signify that they have a question by pressing the raise hand button on your screen or requesting to speak through the chat or when the chair opens up the floor. Members of the public who have joined through the online link will also be able to ask questions and make a brief statement on the item after each presentation. And after the committee has had an opportunity to ask clarifying questions, again, by pressing the raise hand button on your screen or requesting to speak through the chat or when the chair opens the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, granted that there is time and that the committee agrees on the topic. Following the questions, discussion, and public comment portion, the committee will begin their discussion after each presentation agenda item and will conclude with the decision to vote on a recommendation if warranted. When the agenda is finished, the meeting will be adjourned. If there are any questions related to meeting software or to our process, please use the chat function or raise hand function now or contact the Deputy District Manager. And with that, everyone, thank you. I welcome you to our March meeting. As I mentioned, I'm going to pull up the agenda so that folks can know what to expect this evening. Just give me 1 second. This larger for folks. Can everyone see my screen? Perfect. So we've just gone through the meeting guidelines. We'll do introductions and take attendance, follow up from some previous month business and safe disposal programs conversation that we had last month. For new business, we have Neighborhood Shop, representatives from Neighborhood Shop New York talking about the Connects program. We'll have presenters from the New York Academy of Medicine talking about the Aging Well in the Bronx survey. We'll have folks from the Comptroller's Office talking about the Aging New Yorkers survey. And then we will inquire if anyone from DFTA, DOHMH, Moya, Montefiore, or North Central are on and would like to provide updates. We will have a couple of minutes to talk about our next meeting and if there are any topics of interest, and then we will adjourn. And so with that, I'm going to stop sharing my screen and take the chance to call attendance. Again, thank you so much for your patience as I navigate all of these. Okay. Mr. Alfred Grant. Alfred Grant. Helene Wilson. Helene Wilson.
Yes, I am here.
Hi, Helene. Thanks so much for joining. Emmanuel Asamoah.
Yeah, Emmanuel present.
Thanks, Emmanuel. Daisy Perry.
Daisy Perry present.
Hi, Daisy. Thanks for joining. Chad Royer.
Chad Royer, present.
Thank you. And Taina Pena. Taina Pena. Great. The committee does have quorum, so we can proceed with business. So we do have a couple of presenters here tonight. For the sake of just keeping our flow moving, I will call on them to introduce themselves when they are up on the agenda topic. And so we'll move right into our old business. And so at last month's meeting, we had a discussion on safe disposal sites. A couple of committee members and members of the public relayed that there are lack of signage and overall understanding of where folks can discard safely of needles that they're using for everyday medications. For example, insulin. So for those folks that have diabetes. So it was a really robust discussion, and I want to give a big thank you to Chad and Toby and our Deputy District Manager, Carla, for really taking the initiative outside of the meeting and corresponding about how we could first and foremost understand what is available to the public, and second, really understand what we can do to make the community aware of where they can dispose of these sites. So I want to say that in the agenda, there is a hyperlink to a Google document that our Deputy District Manager prepared, and she reached out to the New York City Department of Health and Mental Hygiene for a list of safe disposal sites. So I'm going to read it and then pull it up quickly. But just so folks are clear, all hospitals or nursing homes in New York are required to accept medical waste as long as it's residential waste from a constituent's personal or medical use. There's more information that can be found about the program at the sites that I'm going to pop into the chat right now. It's best to confirm with the facility beforehand, but a map of the drop-off locations for medical waste could be found at the Department of Sanitation's website, which I will also insert in the chat right now. And then DSNY periodically hosts safe disposal sites where people can dispose of medical waste, among other things. Their next event will be on April 29th at Orchard Beach parking lot, and the schedule of their safe disposal sites could be found in the website linked here. And so again, I will download this document and share it. First and foremost, we wanted to know, is there a comprehensive list of sites within CB7? And so we were pointed to the DSNY website for that. So Chad and Toby and Carla have graciously offered to comb that list to find sites specifically within CB7. And then we're also going to work on contacting the facilities within CB7 to see what kind of signage they have. And if they don't have a lot of signage, we can compile a list and share it broadly with our community by distributing it through the community newsletter that goes out on a weekly basis. So that's kind of a recap of what we've done so far, and we'll keep this on the agenda and report back during our next committee meeting. Chad, I see your hand up, and I want to invite you and Toby to add anything if I missed anything in my report out.
Yeah, certainly. So, hi, Michelle, and good evening, everyone. So, one catalyst I want to bring forth is that a lot of the urgent cares in the district and out of district, I found were not willing to accept these kind of sharps disposals. And the reason I make this distinction, they may not be classified as a hospital. I'm not sure if they are, but if they are classified as a hospital, then they need to be in compliance. So that's an area of opportunity that I'm hoping that some of our urgent cares, like the city MDs, for example, that in fact that's the major one, could cooperate. But also the safe event that you mentioned, that's at Orchard Beach. I made a mention of this at the sanitation committee. If there's one that's closer to the west side, and for reasons that involve space, that's the closest one that is to our district. And I find that the lack of access makes it very difficult to get cooperation from those members of the public when they can just easily toss it and not worry about it.
Thank you, Chad. I will absolutely look into the question about whether urgent care centers are classified as hospitals. My inclination is to say, or I would think, I'm not going to say, I would think that they're not. So we can do some more research there and find out if they're not, what are the regulations or obligations that they're supposed to be abiding by according to the state law. And to the point of the DSNY drop-off locations, I hear you, and I think that this is something that we may want to take back to exec and talk about how we can reach out to DSNY and see if they can do some events in the other part of the borough. Since I agree with you, it is out of the way, especially if you don't have a car. You know, the public transportation there's a bus there, but it is a big stretch for folks on our side to cross over. So thank you for your comments. And I think that those are definitely two good points to follow up on.
Thank you.
I don't know if anyone else on the committee had anything to say or had any questions about this. Any members of the public have any questions about this? Okay. I don't see any other questions, so we're going to move to our new business. So as I mentioned, we have a couple of presenters tonight, which we're very grateful for. Tonight, we have folks from Neighborhood Shop here to talk to us about the New York Connects program and to ask for a letter of support from the committee. So this is going to be an item that we will be voting to bring forward to our executive committee and then also our full board for approval. And I believe we have Jaidiris Dominguez on from NShop, Neighborhood Shop, to talk to us. So Jaidiris, take it away, and please let me know if you need to share screen.
Hi, good afternoon, everybody. I will give the floor to my supervisor, who is also with us tonight, is Jessica Dionisio. So please, Jessica.
Thank you, Jaidiris. Thank you, everyone. I first want to take the opportunity to thank Ms. Cabrera and Ms. Avila for taking the time to invite us and present on our program. So I'd like to start off and introduce myself. My name is Jessica Dionisio. I'm the Assistant Director for the New York Connects of the Bronx program at Neighborhood Shop, which stands for Self-Help by Older Persons Project. It is a multi-service, innovative, non-for-profit agency that's been a leader in the Bronx for over 40 years now, supporting seniors and families and the surrounding communities. As a strength-based program and organization, SHOP believes in the philosophy of self-help and mutual assistance, which is then translated in 11 different critical programs that serve the Bronx community. Our program consists of keeping older adults, their families, and the disabled of all ages connected, informed, engaged, and safe through our NORC program, our older adults centers, OAC centers, community care network program, our case management program, our friendly visiting program, our elder justice and caregivers program, as well as the New York Connects program. The point of entry to shop, to neighborhood shop, is the New York Connects program, which we're here to present on. The New York Connects program helps and supports individuals of all ages, any disability, and caregivers. It is funded by the New York State Office for the Aging and administered by NYC Aging, formerly known as New York City Department for the Aging. New York Connects is your trusted place to go for free, unbiased information and assistance, which helps Bronx residents of all ages to remain independent in their daily lives by helping individuals make informed choices about long-term care services and supports. Professional staff can provide options counseling to help Bronx residents link with home care, caregiver support, care coordination, respite care, transportation, home delivered meals, health insurance, information, and so much more. So I would like you guys to picture this. Imagine having to seek help from an agency for gaining home care services, but being transferred from multiple entities without being properly assisted, which we get that every day with our clients. New York Connects, though, is a one-stop shop that uses the no wrong door method and provides the needed assistance for Bronx residents to successfully navigate various social systems and services. I would like to take the opportunity to now introduce the New York Connects outreach specialist, Ms. Raidiris Dominguez, who can provide you with some examples of the calls that we get on a daily basis at New York Connects.
So hello guys, once again, thank you so much for the invitation. As my supervisor already mentioned, my name is Raidiris Dominguez and I am the outreach specialist for New York Connect to the Bronx. So just to give you an example of some of the calls that we get and to make sure that everybody understands well what New York Connect does for the community is to emphasize that when we mention long-term care services, it's not just home care. Is any services, programs, benefits, entitlements that require that the individual requires for over 120 days. Having said that, let's say hypothetically speaking, one of the calls that we get frequently is, I'm going through a financial hardship. So what do you do in circumstances like that? So a person is going through a financial hardship. What programs, what services, what resources are out there to help this person improve their quality of life and their financial situation? That's when we connect them to, or we help them with taxes, food stamp, Medicaid, Medicaid savings program that will pay for the Medicaid Part B, connect them to food pantry. Meanwhile, the food stamp is approved. Help them with the low income housing because rent eats your income. Connect them to places where they could get a reduction on their medication if they are getting medication. So that's pretty much what we do. We help every individual that call us navigate the social service field and connect to those services that are within the community that will help them improve their quality of life. And we get over 400 calls per month. So that tells you how imperative it is to provide this knowledge to the community, to educate them, to empower them with knowledge. And so to ensure that they know that there are services for them that they can tap into and that they cannot, and if they cannot do it on their own, obviously that's what we're here for, to help them, to connect them from point A to point Z, because that's what we do. We actually follow through the process. It's not just like a regular call center where you call, get a number, and then we send you your way. No, the information and assistance specialist that the person will be speaking with will ensure through follow-up, various follow-up, that once we give the information, when we assist you, that you are successfully connected to the services and to the benefits and to the entitlement that you call initially for. And not only that, not what you initially call for, but all of the other services that you probably didn't even know existed, we will connect you to. We get calls from housing. You know how housing it is. It's crazy. I think we all been there. We connect them to transportation, not only access a ride, but also community-based organizations such as RAIN, Meet Bronx, that provide transportation services. And it's just a variety of services that our community are not aware of. And we are the single point of entry to make sure that those services are within community, that are funded by the city, the federal and the state government, are utilized properly, especially on this borough, which is unfortunately underserved.
Thank you so much, Rai Davies. And like Rai Davies mentioned, we provide a wide variety of services. And I would just like to add that we like to make reference to 311. We're similar to 311, but the difference between New York Connects and 311 is that we, like Raidevi said, we follow the person through. We provide follow-up, right, to make sure and ensure that the person has been connected. Whereas if you call 311 for any type of resource, you're getting multiple people and you're only hearing from this person at that point. You're not going to receive a follow-up call like, oh, were you able to get through to this contact that I provided you? So that's what differentiates us in one way from 311, but we are similar to them. Some ways that we provide our services with information and referrals are over the phone, via email, in person, as a walk-in client or a scheduled office visit. We also do off-site home visits as well if needed. And our main office is located in the South Bronx at 975 Kelly Street. And our main phone number, our main phone number is 347-862-5200. And I'll have Raidevis, if you can add that on in the chat as well. And lastly, I would just like to inform you that the New York Connects program is not looking for your support. As NYC Aging has put out a request for information for the New York Connects program, and SHOP plans to reapply, as we have been successful with this program since its inception back in 2015. We're working diligently to keep the program that, so that we can continue to provide the effortless service to the Bronx community. With that being said, we greatly appreciate obtaining a letter of support from the Community Board 7 as we continue to work together in providing the much needed services here in the Bronx population. Moving forward, I would like to encourage you all to keep our contacts and share any community events for outreach so that we can work together to help our Bronx residents. But thank you so much for your time, and thank you for having us present on our New York Connects program with Neighborhood Shop. Thank you.
Thank you, Jessica and Raidevis. And Jessica, I apologize. I didn't see you on my Zoom screen.
No worries, no worries.
Joining us and for giving us that great overview on Neighborhood Shop and this wonderful program. We appreciate you reaching out to us. And I think that seniors are a really invaluable part of our community. Earlier this year, we heard from a couple of seniors during a committee meeting who said that they were starting their own programs because they found that seniors are disconnected, especially post-pandemic, after a lot of the senior centers have closed down. In many cases, seniors are experiencing hardships, like you mentioned, but even with in terms of emergency food, like we're seeing food shortages for seniors, especially we understand as inflation has really gone up. So I really just want to commend this program and the work that you're doing, and appreciate you coming to the committee for a letter of support for our committee members. I'm going to call on you if you have any questions for our presenters, but I do want to indicate that this is something that we will have to bring as a motion in favor of, vote on, and then this will go to our executive committee on Thursday and full board meeting next week for final approval. And so with that, I see Chad, you have your hand up. Please, please unmute yourself and ask any questions.
Yes. So good evening. And I want to thank you for that presentation. I wish I knew about your organization prior to my dad passing a few years ago, because he, as a senior citizen, did face some difficulties. But having said that, I just want to find out what is the level of reach your organization have been able to do when it comes with our older folks who have cognitive disabilities and or our US veterans.
Okay. So,
Go ahead, Jessica.
okay, and you can jump in right in, Vivis. So with, we receive the majority of our calls are from older adults, here in the Bronx. And with those who are suffering from cognitive, impairments, it's all in our name, right? New York Connects. We are always connecting them to resources that can further assist them, especially if they don't have, and many do not have, any informal support. So we, either have to refer to adult protective services, or if they have their families involved, we provide them with caregiver support. We provide them, we always probe on that initial call what the care, like we call them, the caregiver and the care receiver might be needing. And if it's someone with a cognitive impairment, is home care in place? Is home delivered meals in place? Do they need to be linked to a case management agency? Are they having any food insecurities? Do we need to provide them with any food pantries in their areas, right? But we don't look at just the care receiver, right? We look at the caregiver as well. We look at the entire picture, right? So every call is different, but we always provide the resources out there for any type of group, because we receive calls from anyone of any age, of any disability.
And just to jump in terms of the veteran population, we are in constant communication with those social workers that provide services to the veteran population. And we also assist professionals, giving them the tools that sometimes they lack the knowledge about, so that they can provide it to their clients. And if the veteran is not aware of entitlements, or the social worker that is dealing with this veteran is not aware of some of the entitlements, we can educate that social worker, and that social worker can, link that person. Everything is just based on providing the knowledge and the adequate care that the person requires at the moment. Like my supervisor says, every case is different. So it will depend upon the case and the situation that the person is facing.
Got it. Thank you.
No problem.
Do any other committee members have their hands up or a question? Awesome. We'll move to board members. Hi, Toby. I see your hand up. Please unmute yourself.
I wanted to ask the question, given the fact that Kelly Street is in the South Bronx, is there any other location that New York Connect operates for other seniors? And does New York Connect have a case management department where people can go to the homes of these seniors?
Yes, thank you for mentioning that. That's one of the points that we failed to mention. We have a long-term care counselor that is able to, depending on the situation, once again, to make that connection in the comfort of the home if a person is homebound and doesn't have, that particular service at the moment. We can connect them to case management. And every borough has their own hub. So we tend to care for Bronx residents. However, Manhattan has a New York Connect, Brooklyn has a New York Connect, and so forth. So every borough has a New York Connect. And like I said, if the person is homebound and need a particular service, we have a long-term care counselor that is able to travel and go to the individual's home and make that connection of the service. And for ongoing services, then we will do a referral for case management. Remember, the area of the Bronx have 3 case management agencies. One is through our neighborhood shop, community district 1 through 6. Then we have JASA, I believe it's 9, 10, and the rest of the community districts are covered by RAIN. So depending on which community district the person falls under, they will make that connection for continuing care through the case management agency.
Okay, thank you.
No problem.
So much. I see Alfred, you have your hand up. Please unmute yourself. We can't hear you, Alfred. We can't hear you yet, Alfred.
If you're having trouble with the communication, you can feel free to write it down on the chat and I can read it.
Alfred, if you're trying through the phone line too, or cell *6 mutes and unmutes you. We still can't hear you.
It has happened to me before, because usually when we connect through a tablet or a cell phone, you know that pop-up that tells you dial in or so forth. If you don't hit it right quick, it will not give you access to audio. But Alfred, feel free to write down to write in the chat.
Mhm.
Yeah, Alfred, and we have their contact information, so we can certainly follow up if it's a question that doesn't get addressed tonight. So I now invite committee members, if you have any questions about the letter of support, please feel free to unmute yourselves and ask. And I would also ask if there is a motion on the table to vote on this item.
So if I can ask, they're asking, okay, so the board is asked for a letter of support for the application to be considered for renewal, right?
Yes.
Well, I'm sorry, Cromwell. We're actually applying for the first time, even though that we have had this program since the inception, 2015. Our NYC Aging is now requiring each borough to apply for what is a request for information. So we're sure we're going to remain with the program, but we have to do this process of the request for information that the NYC Aging requires.
It's pretty much to fulfill protocol.
Mhm.
We have been successful providing the services to the community. We have been in 7 years without a citation. So we're sure that we're going to continue with the program and with the success, God's willing, because you never know what may happen along the line. Some things may be out of our control. However, you know, we are certain that we are in good standard. However, the Department for the Aging, the NYC Aging, requires us to follow those steps. And as one of our funders, we need to comply.
Okay, so this is really directed at the Department of Aging in a sense, right?
Yes.
Okay, so Michelle, if I could entertain a motion for the board to write a letter of support for SHOP to, how do I say this? For SHOP to get approval for application with NYC Department of Aging.
Jessica and Radis, could you just clarify the last piece? And I apologize, chat is being so wonderful here. We have to, this is gonna enter a motion, and so we wanna make sure that we're articulating the wording exactly as it.
Mhm.
If you could please, yeah, help us.
Yes. So requesting a letter of support for neighborhood shops New Year Connects program that is being requested by NYC Aging.
Chad, are you okay? Do you accept that amendment?
That's fine. I didn't quite catch all of it. Uh, I don't type well on an iPad.
It's okay.
No, no, no. No worries.
Formality.
Jessica, just
Now I'm like
is
blanking
there any
out.
way you
What
can,
exactly? What you said? What I
is any way you can write it, the wording that should be used in the chat?
Or would that help, Chad, if I write it out on the chat?
Yeah, and then we as board members will just have to curtail it a little bit.
Okay.
We have a format if that will make it easier on you.
Yeah.
Oh, you do?
Yeah, I have.
Yeah.
I had
Okay.
sent it out to Ms. Cabrera and Ms. Avila.
Yeah.
And thank you so much, Chad, for taking the initiative. I really appreciate it.
Yeah, thank you.
Jessica, just to confirm, are you noting it down in the chat?
Yes, I'm writing it now. Motion to-
And thanks to everyone for their patience.
Anybody else has any inquiry, question, get it out of your chest now. I'm here.
Radiris, I put the brochure in English in the chat. I'm downloading the Spanish one as well, but I'm wondering if you could talk to us while we get the motion language about your outreach campaign or outreach strategies, since seniors,
Oh,
you know,
girl, don't get me started.
right, I think that would be great and would help us also as we share this information with our neighbors.
Well, right now, our main target is hospitals. It has been quite a hassle for me to get into the hospital setting, especially to assist those seniors who are transitioning from a nursing home into the community. I have encountered throughout the years that I have been working in EuroConnect that sometimes with the social worker and the doctors at the nursing homes, the transition is not as seamless as it should be. And seniors do not count with the support that they need to in order to go into the community and live successfully as they should, so that's one of my main targets right now, the hospitals. Also the disabled community. I'm trying to get in touch with Unique. It's a new organization that, well, not so new, but new to me actually, that they assist the disabled, because we not only care for the seniors, we also tend to the disabled of all ages. I have been targeting public libraries. People go there to look for information. NYPD, we have been successfully making that linkages. NYPD, sometimes when they have a lot of cases of elder abuse. So I'm trying to create a stronger bond with the NYPD. Is that the line that you were asking me for? Like what is my plan moving forward, or?
That's helpful to know. I was wondering if you all also do like street outreach, like tabling.
Oh,
at-
yes.
Oh, she's asking. Okay. Yeah.
Okay.
Yeah. Ladies is our outreach specialist.
Yes, I do tabling. Actually, we doing a tabling next month at Sage. I don't know if you know, it's a building for the LGBT community. We're doing a tabling there. We have been participating in different events with some older adult centers. That's mostly, where we do tabling. We did an event with the NYPD at JASA. When was it, Jessica? Last month?
Yes, I believe last month. And we're always doing tabling events at our OACs and different OACs around the Bronx as well. And now, since we're going to the warmer weather, diabetes will definitely be taking part in more outreach events outside than through Zoom.
I'm famous. I'm on my seniors. I'm famous.
I guess I could give it a shot here.
Sure, Chad. One
So-
second.
Okay.
I see a 347 number that has their hand up. I'm wondering if that's a committee member and if there is a question.
Yes, it's Taina Pena speaking. I just have a question I'm just curious about. I do see that in the kind of the request that they put out something about the RFI, the request for information.
Fine, go.
I'm just
Sorry,
wondering
sorry.
how does that connect? No worries. I'm wondering how does that connect to the letter of support that the board would be writing for this specific program? How does the RFI connect, or is there any connection with the letter that we would be writing of support?
There is a direct connection, Taina, and that's they are asking for the letter of support as part of their application to this request for information. And Jessica,
Okay.
correct me if I'm wrong or add
Mhm.
anything there.
No, that's it. And Michelle knows we provided like a template of what my supervisor, the chief program officer from Neighborhood Shop has created. But it could be, switched around, whatever the board wants to do. But it's basically just noting in that letter that that the board would support Neighborhood Shops, New York Connects programs, and ongoing collaboration and providing services to the Bronx community.
Thank you. I apologize if I missed that. I was just a little
No,
confused
no,
on that
that's
part. Thank you.
No worries.
Thanks
Thank you.
Thanks for asking the question, Taina. No worries. Okay, Chad, if you're ready, floor is yours.
Okay, so I move for CB7 to provide a letter of support for Neighborhood Shops NYC Connects of the Bronx program that is in the application process for a request for information by NYC Aging, Department of Aging.
That's exactly up to the point.
Do we have a second for that motion from committee members? Alfred,
Second, Daisy.
thank you.
I
Thank
second the motion. Helene.
you. Okay, I'm gonna call each member by name so that you can say if you are in favor or against the motion. Michelle Avila approves the motion. Alfred Grant? Alfred, are you able to unmute yourself? No? Okay. Helene Wilson?
I approve.
Thank you. Emmanuel Asamoah?
Emmanuel Asamoah, I approve the motion.
Thank you. Daisy Perry?
Daisy Perry approves.
Thank you. Chad Royer?
Chad Royer approves the motion.
Taina Pena?
Taina Pena approves the motion. I apologize for the delay.
Wonderful. Thank you so much. The motion passes. Thank you to Jessica and Radiris. As I mentioned, this will now go to our executive committee meeting, which is on Thursday, March 23rd. And then it'll go to a full board vote on next Tuesday. And so we do invite you to join both meetings if you are available. If you're not available for either one, just please let me know and we can connect on any additional information that you would want us to relay in support of this motion. But thank you so much for your time and we really appreciate the work that you're doing. And I think we want to invite you also, we have a resource fair that happens usually in the summer. So if you are up for it and the date works, we can have you join us. This is really important service that we need to get the word out about.
Michelle, please forward me I put I'm gonna put my email so you can forward me do you have a flyer?
I think I will have to check with our board staff. They are the masterminds behind everything logistics here. So I'll check with them, but I'll make sure that we get that to you. And I believe it will be in the summer. So we'll definitely keep in contact about that.
Okay.
Okay.
Thank you so much.
Wonderful.
This is the pool park. Oh yes, I'm down there.
And Taina, I see your hand up. Did you have another question before we move to the next agenda item? Okay, we'll move forward then. So next up, I would like to invite Mario Rubano, and please correct me if I said your name incorrectly, New York Academy of Medicine, to talk about aging well in the Bronx survey.
Yep. Yeah, that's pretty much it. Mario Rubano. I get a lot of Marios down here in the city, but I'm used to it by now.
Yeah.
So no, special thanks to Carla and Michelle for the invite, but also to Neighborhood Shop. They just have a stellar reputation, just doing invaluable work up in the Bronx. It feels good to be back in this area virtually. I worked for about 7 or 8 years on West Kingsbridge Road at the nursing home there, right next to the VA hospital, and around the corner also at Cathay Senior Apartments. So yeah, very familiar with the area. I'm just going to share my screen real quick. And let me know if that's coming through all right.
Yes.
That's perfect. Thank you.
Great, thanks. All right, so I'll try to keep this nice and quick. So this is the Aging Well in the Bronx survey. Going to give you a little bit of history on it, but right off the top, this is funded in part through Borough President Gibson, as well as council members Eric Dinowitz and Marjorie Velasquez. So big thanks to them for finding some discretionary funding to help us pull this together. So just gonna do a quick introduction to the New York Academy of Medicine, the Center for Healthy Aging, then dive right into our age-friendly borough work and do a quick overview of our survey. So the New York Academy of Medicine, we've been around for 175 years at this point. So a long and storied history here in the city. And in a nutshell, we're driven towards achieving health equity. We don't work specifically with older adults. We have a number of different centers within the Academy, of which the Center for Healthy Aging is one. We have community partnerships and policy solutions. They do a lot of maternal health and early childhood health, as well as the Center for Evaluation and Applied Research, which is kind of our scientific arm. We do a lot of evaluation and research through them. We also have a world-class medical history library, which includes just old tomes, tons of old books from hundreds of years ago, as well as George Washington's false teeth. Believe it or not, we have those on file, pretty wild. But the Center for Healthy Aging, we work specifically to address all the needs of the current aging population, but also future aging populations, which is where this age-friendly borough survey kind of comes into play. Because we are trying to meet the current needs, but we also want to anticipate the future, especially with the older adult population growing faster than any other demographic in the country. So a few years ago, we received some funding from Gail Brewer, then Manhattan Borough President, as well as the former Brooklyn Borough President, now Mayor Adams, to do these 2 reports, the age-friendly boroughs reports. And so for each one, we ended up surveying about 1,500 older adults. And that was just getting their experiences, their everyday experience in the boroughs. And this is addressing all of the different domains of what's called age friendliness, which you can see on the bottom right. That addresses transportation, housing, social participation, a number of different items. And so the goal was to go straight to the older adults themselves, rather than trying to figure out, in your office behind your desk, what older adults need. Bring the survey to them and get their opinions. Elevate their voices as best you can. So we did that for both Manhattan and Brooklyn. And then we were able to get some funding from Mayor Adams as he was transitioning into his current role to kind of take the next step from these reports. Because each of these reports, we analyzed all the data and we came up with a number of recommendations that each borough could do, recommendations, steps that they could take to improve the age friendliness in a borough specific way for each participating borough. And his next step was to put together a task force that could do something with the report, do something with all these recommendations. So what we did last year was we convened, it was about 30 task force members representing a number of different organizations across Brooklyn. And over the course of the year, we had about 3 or 4 sessions. We kind of winnowed down, it was nearly 35 recommendations. We winnowed those down to 10 priority recommendations and included those in a condensed report with specific steps that the borough could take to implement everything. And we're actually having a report launch event on Friday this week with the borough president at Restoration Plaza out in Brooklyn. So this is all part of a multi-year sequence that we're hoping to start in the Bronx as well. So this is just a quick snapshot of the Brooklyn Task Force. This is our report. You can see we pulled out housing and digital equity, some action items. But we want to get into aging well in the Bronx because we're in the Bronx right now. So this survey it's being implemented in digital and hard copy formats. And there's pros and cons to both of those. With the digital dissemination of the survey, it's easy to distribute the surveys at scale. You just send the URL to your target individuals or to your listserv, your email list. And a lot of the more tech savvy older adults, they could be excited to engage with a survey on their device. A lot of them are oftentimes very proud of their tech skills, and this is a good way to kind of show those off. They can also serve as an intergenerational connection within an older adult's home. Let's say there's a less technologically savvy older adult who has a grandchild that's living in the home with them. That grandchild could help them fill out this survey. It'd be a great opportunity for the intergenerational connection. But on the cons for this digital format, not all older adults own or have access to a digital device. We know that the digital divide is very real, and especially so in the older adult demographic. Digital device proficiency, it varies pretty widely across older adults. And there's also the visual and physical cognitive deficits that could complicate their engagement with a digital format. So that's where the hard copy comes in, which is a tried and true method that's going to be familiar to pretty much any older adult. We've all filled out a survey before. But with that, there's also some challenges with dissemination, with kind of getting the survey distributed in hard copy formats. Not impossible by any means, just adds a different challenge. And the analysis can be a little bit more time consuming as well. But that's something for us to worry about, not you guys. So let's just take a quick look, some screenshots of our digital format. So this is the view through a computer view. So if you were to open this up on a laptop or on a desktop computer, this would be the top, kind of the introduction to the survey. And here's just a snapshot, again, in that same format of some of the questions, just to give you an idea of what this would look like. We stratify the age by 5-year increments because we know that there are many, many differences between an older adult that's in the 60 to 64 range compared to an older adult that's well into their 90s. There's the young old and the older old. So we're really trying to kind of cut the data into small enough chunks where you can get some very meaningful information. Here's a question just on transportation. This is a select as many as you'd wish kind of answer, so they can check all of the options that they tend to use. And here's the digital survey in a cell phone view. I know you probably have this experience where you open up a website on your phone that you've opened up on your computer before, and you can barely read the thing. So what's great about this format is it will automatically format into a tablet or onto a cell phone to be very clear and readable. You can see there's no layout issues with this. And here's a quick snapshot of the first 6 questions or so of the hard copy version. Again, all the same copy, the same text, just a different technology. So we went through some of these pros and cons. Want to just touch base on how we can get this the survey out to different organizations. So we had a few informational sessions. I believe NSHOP, actually, I think a representative from NSHOP showed up to one of our info sessions. So we did a lot of outreach to aging service providers throughout the borough, just to let them know this is going on. We hosted 3, possibly 4 info sessions where we went through these slides, and we took more time to kind of sit and discuss all the different ways that we could get this information out there. You know, we had representatives from older adult centers, from NORCs, the naturally occurring retirement communities, talking about different ways that they could kind of maximize engagement, kind of get the word out a lot. So one of the questions that we were working with is, how do you plan to engage older adults in your community in this survey? So we had individuals that thought this would be a great opportunity to distribute the surveys in hard copy at lunchtime for a congregate meal setting. Everyone comes in, they pass through the same doors, they would get the survey, have an envelope for privacy, fill them out, something to talk about with their table mates, put it in the envelope and turn it in. As well as a lot of older adult centers have tech classes where they're actively engaged with computers. And so this could be a good way to kind of augment their technology classes. They could just, if they're looking for something to teach, they could fill out the survey digitally with any of their older adult participants. And so one thing that we're stressing with this, again, for maximizing engagement, for really getting the word out there, is that this is a borough-wide effort. That this is, it's not something that's just going to end up in a digital bookshelf somewhere in a report that nobody reads. This is actually engaging as many older Bronxites as we can, and putting our money where our mouth is, which is actually elevating the voices of older adults in the borough and really starting to establish those connections. And this is serving as a first step in kind of mapping out a way forward in the Bronx to make it a more age-friendly borough. And again, this idea that more surveys equals better data. So that's why we're happy to be here this evening, just to kind of get the word out, let you guys know that this is something that we're working on, but also to get your opinions on some CBOs, some faith-based organizations, older adult centers, NORCs, that you think might like to be involved in this. I mean, I'd mentioned before that I have my own personal professional connections to the Bronx over the years, but the Center for Healthy Aging, we're really trying to establish some effective communication and collaboration relationships here in the Bronx. So any suggestions you might have to kind of, again, get the word out on the survey, and more importantly, elevate the voices of older Bronxites, it'd be greatly appreciated. And of course, if there are any questions, feel free to email me, but I'm also gonna hang on for a few minutes here, taking an eye on time real quick. Yeah, happy to answer any questions you might have, engage in a bit of a dialogue that might clear some of this up for you. But again, thank you very much for the opportunity. Just gonna stop sharing real quick since I want to see everybody now.
Thank you so much, Mario. I did have a question. When does the survey close? How long is the data collection efforts open until?
So we haven't set a specific date for closure. We're anticipating about 3 months.
Okay.
The thing is, we're hoping to get saturation, like a high enough number of respondents to give us reliable data. So generally speaking, about 3 months or so, we're hoping to get. I mean, our golden number would be about 1,000 respondents, but that really just depends.
Thank you. And I do see we have a committee member, Taina, your hand is raised. Go ahead and unmute yourself.
Thank you. I do have a question. So I think it's great that a survey was made so that the community can actually have a voice and actually say what are some of the needs. I think that's always the greatest way to hear from the communities, by surveys and hearing their voices. I did hear that in Brooklyn, there were about like 35 recommendations and they were minimized to about 10. My question for you is, what tool was used to prioritize or to choose those priority out of those 35? Was there a specific tool that was used, or how was that concluded in the end?
A great question. So what we did was we distributed the original recommendations to our task force members, all 30 or so organizations, and we hosted a session that had a number of breakout groups where people were able to dig deep into all of these recommendations. And then after that session, they had kind of a take-home survey where they ranked in order of importance for them personally and for the organization that they represent, what they think would be the most important recommendations to address. And so we calculated all those numbers, and that's how we rounded out the top 10 averaged out for all of the task force members.
Okay, great. Yeah, that's a great way to do things. So thank you for answering that question.
Of course.
Thanks so much, Taina. Other questions for Mario? Mario, we have some organizations that we work with. One of our community members, AJ, put in the chat that our office is actually neighbors with the Sister Annunziata Senior Center. So we're happy.
Oh, great.
Introductions, and we can talk to our board staff, who's wonderful, and we'll have a list of active community partners. We'll filter that to those that are serving aging populations to forward you some recommendations. I'll also bring this up at our executive committee meeting. I did want to ask, and again, we try to be creative, because in our community board, we know that there are a lot of folks that are really just going about their day, and you kind of have to meet them where they're at. So for the community board, some of the more successful outreach efforts have been like tabling, going to supermarkets, just visiting places that we know that our aging population really frequents. So do you all undertake those efforts? Would you be open to? That's my question. And then I see Hadiris has a question. We are very old school.
I mean, more than a question, it would be more to an open to collaboration. You mentioned you already have linkages to Neighborhood Shop. However, we have 4 older adult centers. One of them is an innovative senior center, older adult center. So if you don't have that connection yet, you can feel free to email me, and I will get the word out starting through those OACs. And because we have 11 programs, and all of them, with the exception of New York Connect, that serves also the disabled, we can make that survey accessible to all of the seniors that we serve, because we definitely need to know what exactly is their priority, so we can treat it as our priority.
Really appreciate that. Thank you so much. I'll definitely be reaching out. And to answer your question, Michelle, and Mirage the artist, we didn't plan to do tabling, but we're open to anything. So with hearing that these old school outreach techniques tend to work, we'd love to kind of look into that. I know there's I can't remember the name of the street, but it's right behind Montezuma. There's a New York Public Library back there. That could even be a location. Are there other priority locations you might suggest?
I would think that we would suggest the areas where there are heavy business foot traffic. So around the supermarkets, we have a couple in Bedford, Norwood, the Fordham area that come to mind. Again, Mario, I'm happy to start a Google Doc and bring this to our exec committee. We have a community board member that said Eames Place. AJ is saying VA, the Montefiore. We have contacts with Montefiore and North Central and Food Town. So I'd be happy to kind of compile these with contact people and share them with you. I think we agree with what Hadidi said. This is very important for us as a community to understand our seniors' priorities. So we'd be happy to help make some linkages.
Great. Yeah, very much appreciated. Just loving all the attention tonight given to older adults with all the guest speakers. This is really a promising sign. So again, thank you all for the time and attention. I hope you don't mind if I stick around for the rest of the meeting just to listen in to the next speaker.
Absolutely, absolutely.
Thank you.
Thank you, Mario. Thank you so much for joining us tonight, and we will absolutely continue to be in touch. And you are right, this is a very heavy senior resource focused meeting tonight, which we're very glad to have. And so I want to invite as our next presenter from the New York City Comptroller's Office. Is it Greer Mayhew?
Perfect. You said it perfectly. Thank you so much, Ms. Aguilar. Good evening, everyone. I'm Greer Mayhew. I'm the Bronx Borough Director for the New York City Comptroller's Office. And just to echo what everyone's saying, it is wonderful to hear so many people interested in really embettering the lives of seniors throughout the city, rather, not just in the Bronx. But yeah, so I'm here to also report on a similar survey that our office is doing. We're calling it the Aging New Yorker Survey. One of the roles that the Comptroller's Office has is to ensure that New Yorkers have access to city services. And the Comptroller Brad Lander, he is very intrigued on hearing it directly from the people. So he has done during his first tenure, some surveys. So this will be the second survey. And it's basically to really for our office to understand the experiences that seniors are having as they interact with city services, to understand the gaps that may come up. And we're asking questions about housing costs, access to housing vouchers, preparedness for extreme weather emergencies. This survey would help our office because we also audit agencies. So this would help our office determine what agency we should look at. What numbers are they getting and how they're reaching seniors and providing services that our seniors need. So this is actually a citywide survey. We're doing it in all 5 boroughs. We are going to senior centers. We're going to community boards and other community organizations and civic groups to help spread the word. I mean, it's funny. It's kind of similar to the New York Academy of Medicine survey, but yeah. And the cutoff, we don't have a cutoff time as of yet. We're looking for April. I think the idea for us is that we would like something to present during Older Americans Month in May. So we're looking for that, but that is subject to change, especially in regards to data and, if we think it suffices for us to actually provide a substantive report. We are also doing language translations. So that's coming out a little later. I think we're doing about 7 languages. We're going to be translating them. And of course, it'll be Spanish, French, the main ones. And yeah, and I think that's about it. I can put the link in the chat for everyone. We have, we have an online virtual option for folks to fill out the survey, and also we have a PDF version. So if people want to print it out and give it out, however, it's easier. And also we're going to places as well. So, but that's really all for me. If anyone has any questions, let me know.
Thanks so much, Greer. I do see Jake Wilson. You have a question. I apologize for missing you earlier. Please unmute yourself and feel free to ask your question.
Hi. My question is, let me put my face there. Oh, wow, wait a minute. My question is unrelated to what you just spoke about, but I think that you could kind of give me some light on it. I was at Gustavo Rivera's Black History Month program, and I received a vaccine. And the vaccine that I received was not logged with NYC. So I'm at a function. I flew all the way down to Miami, Florida for a function that I had to have that vaccine for. And I have not yet entered into the venue because I've been calling them all week to find out about the vaccine. Why hasn't it been logged? That was the question that I asked when I accepted the vaccine. I don't know what the heck I got. And nobody else knows because it hasn't been logged. For all I know, they could have gave me a placebo. That is unacceptable. If I was going out of the country, I went out of the state. I'm in Miami, Florida. I took this on February 25th. And I have no proof that on my NYC Vax that it even happened.
Jake, I'm sorry to hear that. This is something that we can definitely follow up with our board staff and reach out to the senator's office and immediately, to try to get a resolution. But I do apologize, and that is not something that
That's something that we need to look into, because how many people are going through the same dilemma? It's very unfortunate. You understand? You tell people to come out, get the booster, yada, 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 and then you're not even responsible for the paperwork. Come on. That's unacceptable.
Agreed. Absolutely agree. And again, we've had a lot of conversations about vaccines and the importance of vaccines, but also trust, information and trust, and anything that corrodes trust between members of the public and members of the medical community or our government is not acceptable. So we will follow up. I'll connect with you, Jake, and I'll give our board staff a heads up, and we'll work to get something resolved as quickly as possible.
Right. Okay, cool.
Thank you.
Thank you.
Are there any questions for Greer or comments? And Greer, we can also share with you some of the organizations and contact folks. It sounds like we can use both for these purposes, so happy to do that. I believe Mariel put in the chat that the New York Academy of Medicine survey is available in English, Spanish, Bengali, Italian, Chinese, and Russian, which is wonderful. We have many of those dialects in our community board, so appreciate that.
Yeah, those were identified as the top 6 languages for the borough.
Thank you. Any other questions for Greer? Awesome, Greer. Thank you so much for joining us. And again, we'll be in touch to link you to Community Board 7 specific suggestions.
Thank you so much. Have a good evening, everyone.
Thank you. So now we will call on city agencies and some of the hospitals that are in our district, if they're in attendance, to give quick updates. Do we have anyone from the Department for the Aging on with us? Anyone from the Department of Health and Mental Hygiene here with us tonight? Anyone from the Mayor's Office of Immigrant Affairs? Anyone from Montefiore Hospital? And our partners at North Central apologize. They could not be here tonight, but they would share any updates via email, and we'll be sure to circulate those with the committee, but they're always present and really relayed in advance that unfortunately they wouldn't be able to make it tonight. So wanted to share that. Our next meeting date is April 18th. And I want to move into, are there any items that committee members or members of the public would like to put on the agenda for next month?
Michelle?
Hey, Chad, yep. Go
Yeah,
ahead.
I couldn't find the hand raise. I'll be curious to find out what our neighborhoods at large are doing regarding autism awareness. For those who may not know, I have a teenager who is on the autistic spectrum, and a lot of folks, I'll just say it, they glorify autism awareness, but then the question is what happens during May 1st? And I haven't seen or heard not too many mentions of what we are doing for our folks with autism outside of parents looking at their children's IEPs and making sure they have services being delivered. So I'll be interested in finding out what folks are doing and what they actually know and understand about autism awareness. Because if I wasn't inside the circle, if I wasn't the circle, I wouldn't know about it.
Thanks, Chad. That is a really good issue to flag. Say, folks, are you talking about like larger organizations like the hospitals, or do you have a target audience in mind, or is it more broad?
Our community at large, pretty much. What happens is that you have folks, especially if there are cultural stigmas, where their parents will not even take it seriously, and some areas where there's a language barrier, they don't know how to navigate, they don't know who to ask, so they miss out on time when it comes to getting the evaluation that gets the child the diagnosis, and the diagnosis is what gives the parents the opportunity for the child to get the services needed. I just think there's a huge opportunity here.
Thanks, Chad. I'm going to note that for next month's discussion, and I will ask our wonderful board staff to see if we know of any organizations that are active, and we'll also ask our hospitals, who are some of our larger partners, to see what kind of programming they have going on, and we can definitely email to see who else we'd want to bring into the discussion. I see Toby's hand up, and then I see Hadirisi's hand up. So I invite you to unmute yourselves in that order, please.
So I also have a loved one that lives life on the autism spectrum. And I was wondering if Community Board 7 might be open to having perhaps an open house where family members can learn about the services that people that live life on the autism spectrum can tap into, what agencies, how useful care management is, transition coordinators. Is that a possibility?
Toby, I think it is a possibility. I can bring this idea to our executive committee meeting on Thursday. And when you say open house, are you thinking something online, like a digital forum, or are you thinking something in person?
Hopefully it can be something in person, even if it's something that we may have to do out in one of our city parks. Perhaps, I'm not sure if we'll be able to access our community board. Oh, you know what? You think probably Montefiore may be able to host it for us?
I think that if we move forward, we could ask one of our hospital partners. Again, I think they have the direct linkages to programs oftentimes, and a lot in space and services. So we could partner with them, co-host and see if they'd be open to inviting other providers to be a part of that. So I definitely think that's something we could explore.
Thank you.
Yeah, and ladies, go ahead, please unmute.
No, I just wanted it to share, if that is a topic of interest, the Office of People with Developmental Disability, they do have a unit that is specifically for outreach, just as myself. And they could definitely try to bring someone, you can definitely reach out to them, or OPWDD, and they can send someone to educate and provide the information of the services that are available to not only individuals affected by autism, but also any other kind of developmental disability. OPWDD.
Thank you, Ladies.
No problem.
Toby, I'm wondering, I saw your note about being in contact with OPWDD. Have you connected with them before? We can.
Well, I mean, that's my, how can I put it? Like, I've been employed by the IDD field for many, many years. So I'm very familiar with OPWDD, CCOs, care management, community hub, day habilitation, residential life. So that's why I think it's important. Okay.
Thanks, Toby. Let's follow up. This is exciting, and it sounds like we could loop in some larger partners, state, city, and then also some local partners. Thank you. Thank you to Chad for bringing this up. Chad, I see your hand raised.
Yeah, I was just going to say, I might have a contact at OPWDD. I just have to dig through it since we've been through the process. I know a couple years back, turn back the clock, right? 3 years ago, leaving college and our community board through our health committee, we hosted two events. One had to do with the Turning Early Intervention Program, and the other had to do with the 30 years since the ADA Act with Lehman College. So I could definitely see if I can find that contact, because that would be worth exploring. We can even invite them at the resource fair in June. And hopefully, if things line up the way we want, they can be our neighbors who show up all the time. And I'm thinking that's probably the goal, if that makes sense, to have them come to our meetings, be regulars, and share information that's needed to the public.
Absolutely. Thank you, Chad. It sounds like we have some contacts, so I'm very excited to move this forward. And I saw that AJ also said that, yeah, we can invite them to the resource fair. So we have a couple of avenues to explore. Really appreciate Chad and Toby, you all elevating this issue. Thank you. Are there any other topics, ideas that folks want to put forward? Awesome. Well, there is the last item is adjournment. So I will entertain motions for that. But before, I want to say thank you to all of our presenters, Jessica, Radiris, Mario, Breer. Thank you so much. Thank you to all of our committee members, board members, and members of the public for joining us. This has been a really fruitful conversation, and I feel very grateful to have such a strong community interested in these really important topics. So I look forward to the work ahead. Are there any motions for adjournment?
I move to adjourn the meeting.
I second the motion.
Emmanuel seconds the motion. All in favor, committee members? Aye.
Aye.
Aye. Thank you. Thank you. All right, everyone. Have a great night. Thank you so much.
Good night.
Thank you.
All
Good
right.
night.
Great meeting.
Likewise. Thank you.
Bye-bye.
Thank you.
Bye-bye.